How does bladder squamous cell carcinoma affect you? How does bladder squamous cell carcinoma affect you? This type of cancer arises from squamous cells that line the bladder and is often linked to chronic irritation or inflammation. The impact on your health can be significant, primarily affecting bladder function and potentially spreading to other areas if not addressed. One of the most common symptoms you may notice is blood in your urine, known as hematuria. This can be visible or only detected through tests. You might also experience irritative bladder symptoms, which include frequent urination, a strong urge to urinate, pain or burning during urination, and a constant feeling of needing to urinate even when your bladder is not full. In more advanced cases, symptoms can escalate to pelvic or lower back pain, difficulty urinating, or even an inability to urinate. You may also notice signs of a urinary tract infection, such as burning or pain during urination. Other systemic symptoms in later stages can include weight loss, fatigue, bone pain, and swelling in the feet. Bladder squamous cell carcinoma is often associated with chronic bladder irritation or inflammation. Conditions such as recurrent urinary tract infections, long-term use of indwelling catheters, or infections like schistosomiasis can contribute to this irritation. Chronic cystitis, which is inflammation of the bladder, can create an environment that promotes abnormal squamous cell growth. When it comes to disease progression, bladder squamous cell carcinoma is typically diagnosed at a more advanced stage than other types of bladder cancer. This can lead to a poorer prognosis. The cancer can invade deeper layers of the bladder and nearby tissues, causing pain and urinary obstruction. It may also spread to lymph nodes and other organs, complicating treatment and reducing survival rates. Treatment often involves surgical removal of the bladder, known as radical cystectomy. This may be combined with chemotherapy or radiation, depending on the stage of the cancer. The prognosis can vary but is generally less favorable than for other types of bladder cancer. 5-year survival rates can range from about 1/3 to just over half of patients, depending on how advanced the disease is and other factors. Early diagnosis is crucial, which is why it is important to seek medical evaluation for symptoms like blood in the urine. If you have risk factors such as chronic bladder infections or irritation, regular medical follow-up is essential. Avoiding prolonged use of bladder irritants and managing infections promptly can help reduce your risk. Any persistent urinary symptoms or visible blood in your urine should prompt a timely consultation with a healthcare provider. In summary, bladder squamous cell carcinoma affects you primarily through urinary symptoms related to bleeding and irritation. As the disease progresses, it can lead to pain and urinary obstruction, requiring aggressive treatment. Its connection to chronic bladder irritation highlights the importance of maintaining bladder health and recognizing symptoms early for better outcomes. Always consult healthcare professionals for personalized medical advice if you experience symptoms suggestive of bladder cancer.